So I think one of the biggest challenges happening with COVID at the moment is that we've all had to massively adapt our ways of working. So, for example, things that we would have usually been able to do face to face has now had to go digital. And I think that's perhaps particularly relevant for key workers and healthcare workers who have had to really adjust how they work with patients in a massively kind of different way. Um, and I suppose we all have standards for ourselves in terms of how we want to work and what the standards that we want to live up to in our work. And that can be really challenged when there's lots of restrictions imposed on us, whether that's having to distance more from people, not being able to spend as much time with people as we would like or see them as often as we would like. Um, and kind of even just yeah, not being able to have the same physical connection because of having to be hidden behind a mask, for example. And I think that can be hugely challenging for people in hospitals and in key worker roles.
Mm-hmm. Yeah, absolutely. And I think those adaptations, I think we just do automatically, and a lot get dictated just by changes in policy, and then we just work it out as we go. So we don't necessarily get the opportunity to think about what effect this is having and how we're feeling about it. And of course, how we feel about it and what effect it's having will fluctuate day to day. So I guess it's really important just to kind of acknowledge fairly regularly, how you're feeling as a result. And when there are feelings like frustration or even kind of grief or guilt or, any of these things that might be coming up because of these changes and it feeling like it's violating our own standards. Just kind of tuning in to what is going on there. So give him some real space to kind of acknowledge that. And I suppose once you've done that, then it's really useful to share that experience with other people that might be able to kind of empathize and sympathize and process it together. And I think also once you've been able to do that, also kind of consciously making the effort to be a bit kind and gentler with yourself, and acknowledging that this is causing some kind of stress or distress, and that you might have some needs that you wouldn't usually have after a day's work. So it might be extra important to do something nourishing, whether that's have an earlier night, whether that's doing something pampering, whether that's kind of talking with other people. So I guess the steps are really to acknowledge, to try and share, and to have a real conscious think about what's going to be good to look after yourself.
Definitely. I think what you said there, one about sharing with colleagues, is so important because even though it might feel like we're reluctant to share because we know that everybody is kind of in the same boat and we don't want to add to others' stress, actually being able to share with a colleague about how you're feeling and to support them when they might be feeling the same way is really important.
Yeah.
And one of the things that you've brought up there is around that separation between work and home. And I think, for example, usually people might be able to go out after work to, whether it's doing exercise with other people or just socializing over dinner, that might not be possible. So creating that work home distance is really challenging. So finding ways to kind of try to create a gap between work and home is really important. And also kind of switching off the news that might be really kind of present in the day.
Absolutely. And I guess the other additional kind of challenge at the moment is that there's kind of new narratives and expectations that are being placed on a lot of workers at the moment, key workers and frontline workers, about kind of being heroes and things like that. And that does weigh heavily on a lot of people, and can make that even harder to kind of switch off from work. And I guess I would give the same advice in terms of acknowledging the effect that that's having on them, and kind of trying to share that burden by processing it with other people in similar situations. And as we were kind of saying, to then take steps to really look after themselves in ways that they might not have really thought about before.
Yeah, because I think obviously while we're all massively appreciative of the work that key workers are doing, it's really important to recognize that kind of bestowing kind of a hero status on someone just creates a huge amount of pressure for them to live up to. And actually we're all human and everybody is here trying to do the best job that they can do in the current circumstances. And with that is going to come times where people are feeling like work is really challenging and they might be feeling low in mood, um, or they might be just kind of struggling to create that balance between work and home life. So yeah, I think creating space to acknowledge that while some of the work that people are doing is excellent, it's also okay to kind of have time where you're just dedicated to yourself and not having to be the hero.
Yeah, absolutely. Yeah.